There's a moment in every mystery, right before the truth is uncovered, when the questions are louder than the answers. In 1993, in the sunburnt deserts of the American Southwest, a terrifying illness began to surface. Perfectly healthy people, young, active, vibrant, started dying within hours. Their lungs filled with fluid, followed by heart's attack. Doctors were baffled. Panic spread like wildfire. But the real twist? The answers didn't come from high-tech labs or cutting-edge science. They came from the wisdom of the land and the stories of the Navajo people. Welcome to Health Bulletin, Hidden History. And today, we're unraveling the mystery of the Sin Nombre virus, the virus with no name, and how the indigenous knowledge that cracked the case. In 1993, during spring, a Navajo man, young and athletic, known as a marathon runner, was driving through the Four Corners region. That's where Colorado, New Mexico, Utah, and Arizona all meet. He was headed to his fiancée's funeral. She had died suddenly, from what doctors called respiratory failure. Now, on the way, he too began gasping for breath. By the time the emergency crew arrived, he was in full respiratory failure and later died in a nearby emergency department from pulmonary edema. Doctors couldn't explain it. Investigators soon discovered more deaths with the same symptoms, fever and myalgia, followed by rapid decline and death within just a few days. Within an 8-week period, 10 people had died. On May 28, New Mexico state health officials requested assistance from the CDC. The epidemiology team quickly narrowed the cause to 3 possibilities: a new, aggressive influenza virus, an environmental toxin, or a previously unrecognized pathogen. They didn't know it yet, but the answer was all around them. Here's where the story changes. While the government scrambled for samples and autopsies, Navajo elders, called the Diné, recognized something. They had seen this before. Their oral history told of similar illnesses, in 1918, in 1933, always after heavy rain. Always when deer mice swarmed. You see, in Navajo tradition, mice and humans come from different worlds and, therefore, should be kept separate. Upsetting the balance with too much intermingling between species can bring on diseases, like what was seen in the Four Corners region. That year, thanks to a strong El Niño effect, the land was flush with food. Pinyon pine nuts, the main diet for deer mice, had exploded in number. And so had the mice. Elders warned their people to be careful of deer mice and prairie dogs, as contact with their waste could spread disease. They even recommended burning contaminated clothing and sealing food to protect it from rodent access and contamination. This wasn't superstition. This was survival, which learned over centuries. When CDC investigators met with tribal elders, they were informed of this regional history. One of the first important clues to the identity of the pathogen came from these meetings. And slowly, a picture began to form. Armed with Navajo insight, the CDC brought in global experts. Some had worked on mysterious infections in Asia and Europe. They noticed a familiar pattern. In both European, Asian, and Four Corners region cases, infected individuals demonstrated intravascular fluid levels so depleted that hemoconcentration, that means increased concentration of blood cells, occurred, leading to elevated hemoglobin and hematocrit. This observation, combined with the knowledge gained from the Diné, led scientists to consider a previously unknown hantavirus as the culprit. But here's the twist: hantavirus had never been known to infect humans in North America. Still, they followed the trail. More than 1,700 rodents were trapped and tested. Genetic samples were analyzed. And then, bingo! The deer mice, just as the elders had warned, were carrying a brand new strain of hantavirus. One never seen before. Hantaviruses are a family of viruses belonging to the Orthohantavirus genus and are responsible for severe diseases, including hantavirus pulmonary syndrome, HPS, and hemorrhagic fever with renal syndrome, HFRS. While hantaviruses are found globally, those found in the Western Hemisphere, specifically North America, are known to cause HPS, while hantaviruses in Europe and Asia more commonly attack the kidneys and cause HFRS. It spread through the aerosolization of virus particles in rodent waste, or by eating food contaminated with rodent bodily fluids. The hantaviruses found in the U.S. are not documented as transmissible between people. Initial symptoms of hantavirus infection are flu-like, and include fever, headache and muscle pain. These usually begin within 3 weeks of exposure to the virus. In the U.S., severe cases will progress to HPS, which has a 40% mortality rate. Within 24 hours, most HPS patients will experience some amount of low blood pressure. Pulmonary edema and pleural effusion are common, and patients with cardiopulmonary symptoms begin to decline rapidly. As there is no specific treatment for HPS, early detection and care are critical for successful intervention. Symptom management, such as fluid administration, intubation, ventilation, cardiac monitoring and support, are the only ways to manage severe disease progression. Without adequate care, death usually occurs within 24–48 hours of cardiopulmonary system involvement. They had found their killer. Now that the pathogen causing the 1993 HPS outbreak in the southwestern U.S. had been identified as a novel hantavirus, scientists needed to name it. But naming the virus brought a whole new challenge. The Navajo experienced this during the 1993 outbreak when the media dubbed it the Navajo disease. Vacation reservations were canceled, and major events were moved to other locations, dealing a heavy blow to an already fragile tribal economy. Racial stereotyping led to Navajo people being refused service at various businesses, and Navajo students were required to undergo medical testing to visit college campuses. Some scientists wanted to call it Muerto Canyon virus, after the area where it was found. Others said, Four Corners virus. However, the Navajo tribe objected to using the name of a sacred place. They didn't want their homes, their names, linked to a deadly disease. And who could blame them? You see, after the media dubbed it the Navajo flu, racism surged. The tribe had suffered enough. Fear of continued stigma meant that locals objected to that name as well. So, the virus that caused the HPS outbreak in 1993 was officially named Sin Nombre, Spanish for, the one without a name. Sin Nombre takes on a poetic meaning in this way. If stating a name gives something power to harm, then refusing to grant a name takes that power away. A haunting, poetic choice. The lessons we carry forward. The story of the Sin Nombre virus isn't just about a medical mystery. It's about respect. About listening. About the quiet knowledge that lives in traditions we often ignore. Science solved the outbreak, but only after it listened to the land, and the people who've walked it for generations. Today, we're still battling emerging diseases. Still tracking unknown viruses. And if there's one thing this hidden history teaches us, it's this. Sometimes, the cure starts with a story. Thanks for joining me on this episode of Health Bulletin, Hidden Histories. If this story moved you, share it. Because the wisdom of the past still has the power to save lives today. Follow for more untold stories of science, survival, and the unseen threads that connect us all. Until next time, stay curious. Stay human. And remember, sometimes the most powerful voices are the ones we finally choose to hear.